Constant fatigue is one of the earliest and most easily overlooked warning signs that your heart may be in trouble. It's not the kind of tiredness you feel after a long day or a sleepless night. This fatigue is deeper, more persistent, and it doesn't go away with rest. People often describe it as a constant heaviness in their body, a sense that every movement requires extra effort. The reason behind this exhaustion lies in how the heart functions. When the heart begins to weaken or fail, it can no longer pump blood efficiently throughout the body. The result is a reduction in the amount of oxygen and nutrients delivered to the tissues and organs. Since every cell in the body depends on this circulation to produce energy, the lack of it leaves you feeling drained and powerless. Doctors understand that this kind of fatigue isn't just about lifestyle or sleep patterns. It's often a physiological response to a failing circulatory system. Imagine your heart as an engine that powers everything you do. When that engine starts to sputter, it doesn't just affect one part, it slows down the entire machine. The muscles receive less oxygen, so even simple tasks like walking to the kitchen or climbing a few stairs can leave you feeling as though you've run a marathon. The brain, too, is affected, leading to mental fatigue and a constant sense of sluggishness. In many cases, people experiencing heart-related fatigue also notice subtle changes in their daily routines. Activities they once enjoyed start feeling burdensome. Some begin to take frequent breaks without realizing why. Others may find themselves falling asleep earlier or struggling to stay awake during the day. The body is smart. It tries to conserve energy when the heart can't keep up with its demands. What might seem like ordinary tiredness can, in reality, be your body shifting into a protective mode, redirecting limited blood flow to vital organs like the brain and heart itself, while reducing supply to muscles and peripheral tissues. This symptom often develops gradually, which makes it easy to ignore. People might blame it on age, stress, or a busy schedule, but doctors know that when fatigue becomes chronic and unexplained, it could indicate that the heart is struggling. Over time, this constant lack of energy can begin to affect emotional well-being as well. Fatigue can lead to irritability, lack of motivation, and even depression. The emotional and physical exhaustion feed into each other, creating a cycle that worsens the person's overall condition. Medical professionals usually associate this type of fatigue with conditions such as congestive heart failure, coronary artery disease, or cardiomyopathy. In these conditions, the heart muscle becomes weak or stiff, reducing its ability to pump blood effectively. When doctors evaluate patients complaining of ongoing fatigue, they look beyond simple explanations like anemia or thyroid problems. They listen for patterns, shortness of breath, swelling, or chest discomfort accompanying the tiredness. These connections help them determine whether the fatigue stems from the heart's inability to maintain adequate circulation. Ultimately, persistent fatigue isn't just an inconvenience. It's the body's way of signaling distress from within, a quiet but powerful indicator that the heart is no longer working as it should. Shortness of breath is one of the most telling signs that the heart may be failing, and it's often the symptom that brings people to a doctor's attention. It can begin subtly, showing up during activities that once felt effortless, climbing a flight of stairs, taking a brisk walk, or even lying down to rest. At first, it might seem like a loss of fitness or a sign of aging, but when it persists or worsens, it becomes a critical clue that the heart is struggling to meet the body's oxygen demands. The heart's main job is to pump oxygen-rich blood throughout the body, and when it weakens, that oxygen supply drops. The lungs then attempt to compensate, working harder to draw in more air. This extra effort leads to the uncomfortable sensation of breathlessness, even during minimal exertion or at rest. From a medical perspective, shortness of breath in heart failure is caused by fluid buildup in the lungs, a condition known as pulmonary congestion. When the heart cannot efficiently pump blood forward, pressure builds up in the blood vessels of the lungs. That pressure forces fluid to leak from the capillaries into the tiny air sacs where oxygen exchange normally occurs. With those air spaces partially filled with fluid, breathing becomes labored, shallow, and less effective. It's as if the lungs are trying to expand against resistance. This is why some people describe the feeling as drowning from the inside or breathing through a straw. Doctors immediately recognize this type of breathlessness as a sign that the heart's pumping function is compromised. The symptom can appear in different forms. Some people notice they become short of breath only during physical activity, while others experience it even when lying flat. The latter condition, called orthopnea, happens because lying down causes fluid to shift from the lower body toward the lungs, worsening congestion. Many patients instinctively start propping themselves up with extra pillows at night to ease the discomfort. Others may wake suddenly in the middle of the night gasping for air, a frightening episode known as paroxysmal nocturnal dyspnea. These experiences are hallmark features that physicians associate with advancing heart failure. In addition to these mechanical effects, there's also a neurological component. The brain's respiratory center constantly monitors oxygen and carbon dioxide levels in the blood. When oxygen levels fall due to poor cardiac output, it sends signals to breathe faster and deeper. This can create a sense of panic or anxiety, further amplifying the feeling of breathlessness. Patients often describe it as being unable to get enough air, even though they are breathing rapidly. The mismatch between breathing effort and actual oxygen delivery creates a profound sense of distress. This symptom doesn't just affect physical comfort. It impacts quality of life in significant ways. People may begin to limit their activity without realizing it, avoiding stairs, walks, or even conversations that make them feel winded. Over time, this reduction in movement leads to muscle weakness and worsening cardiovascular fitness, which further increases breathlessness. It becomes a vicious cycle, one that doctors aim to break by identifying the underlying heart problem early. Recognizing this pattern of shortness of breath is crucial because it signals that the heart and lungs are no longer working in harmony and that the body's balance of oxygen and circulation is under strain. Swelling in the feet, ankles, or abdomen is one of the most visible and telling signs that the heart may be failing to perform its job efficiently. This swelling, known medically as edema, occurs when excess fluid accumulates in the body's tissues. It often begins subtly, shoes feeling tighter than usual, socks leaving deep impressions around the ankles, or rings becoming difficult to remove. Many people dismiss it as a normal effect of standing for long periods or changes in diet, but doctors immediately recognize it as a sign that blood circulation is not functioning properly. When the heart weakens, it struggles to pump blood forward through the body, causing pressure to build up in the veins. This pressure forces fluid out of the blood vessels and into the surrounding tissues, leading to noticeable puffiness, particularly in areas furthest from the heart, such as the lower legs and feet. From a physiological perspective, this swelling reflects an imbalance between the forces that regulate fluid movement in the body. Normally, the heart, kidneys, and blood vessels work together to maintain fluid equilibrium. When the heart's pumping ability declines, the kidneys receive less blood and mistakenly interpret it as dehydration. In response, they retain sodium and water in an attempt to restore what they perceive as low volume. This retention, however, only worsens the situation as more fluid builds up in the bloodstream and leaks into tissues. Doctors often observe that swelling becomes more pronounced by the end of the day, particularly after long periods of sitting or standing, because gravity pulls fluid toward the lower parts of the body. As heart failure progresses, the swelling may extend beyond the feet and ankles, affecting the legs, thighs, and even the abdomen. Abdominal swelling, or ascites, occurs when fluid collects around the organs in the belly, causing discomfort, bloating, and loss of appetite. Some individuals may also experience a sense of heaviness or tightness in the stomach area, making it difficult to eat full meals. This happens because fluid accumulation in the abdomen puts pressure on the digestive organs, interfering with normal function. In more advanced cases, doctors can detect swelling in other areas, such as the lower back or hands, depending on the person's posture and activity level. What makes this sign particularly important is its subtle onset. Many people notice the swelling gradually and assume it is harmless or temporary. It might appear after a long flight, excessive salt intake, or a sedentary day, but when it persists or worsens, it usually signals that the cardiovascular system is under strain. Physicians use this visible clue, along with other symptoms like shortness of breath and fatigue, to assess the severity of heart failure. When they examine a patient with swollen limbs, they often press a finger gently against the skin to see if it leaves an indentation, known as pitting edema, which confirms the presence of excess fluid. This small but significant test helps determine how well the heart and kidneys are managing fluid balance. Swelling in these areas is not simply a cosmetic issue. It represents the body's struggle to cope with poor circulation and fluid overload caused by a weakening heart. Sudden weight gain is one of the more deceptive signs of heart failure because it often happens quietly and without obvious changes in diet or activity. Many people associate gaining weight with overeating or lack of exercise, but in the context of heart health, this increase is typically the result of fluid retention rather than fat accumulation. Doctors know that when a patient reports gaining several pounds in just a few days, it's often a signal that the heart is no longer pumping effectively. A healthy heart moves blood smoothly through the body, but when its pumping function weakens, blood flow slows and pressure builds in the veins. This causes fluid to leak into surrounding tissues, leading to swelling and an increase in body weight. What makes this symptom particularly concerning is the speed of the gain. Adding 3 to 5 pounds over a short period is not normal and can indicate that the body is holding on to water because it cannot circulate it properly. The process begins when the heart's reduced output triggers the kidneys to conserve sodium and water. The kidneys interpret the drop in blood flow as a sign of dehydration and respond by holding on to more fluid to maintain circulation. This retained fluid, however, has nowhere to go, and it begins to accumulate in the tissues, especially in the legs, abdomen, and sometimes even around the lungs. The result is a rapid increase in body weight that can easily be measured on a scale. Doctors often instruct patients with heart failure to weigh themselves daily, not as a matter of vanity, but as a vital diagnostic tool. A sudden jump in weight is one of the earliest warnings that fluid is building up faster than the body can manage. In addition to visible swelling, patients may notice other signs that accompany this fluid-related weight gain. Clothes may feel tighter, shoes may become uncomfortable, or rings may no longer fit. Some people report feeling bloated or full even when they haven't eaten much. Others may experience difficulty breathing, particularly when lying down, because excess fluid can shift toward the chest area. This hidden accumulation affects not only comfort, but also the efficiency of the body's organs. The lungs can become congested, the liver may swell, and digestion may slow as pressure builds inside the abdomen. Every system in the body starts to work harder to compensate for the excess fluid, adding even more strain to an already weakened heart. The emotional impact of this symptom can also be significant. Sudden changes in body weight can cause confusion or frustration, especially for people who have been maintaining healthy habits. They may feel discouraged or fail to recognize that the gain has nothing to do with diet and everything to do with heart function. This is why healthcare professionals emphasize the importance of monitoring weight consistently and reporting sudden increases to a doctor. For those at risk of heart failure, tracking even small fluctuations can provide critical insight into how well the body is handling fluid balance. Rapid weight gain is not just a matter of numbers on a scale, it is a visible marker of the heart's declining ability to manage circulation and maintain the delicate equilibrium of fluids throughout the body. A persistent cough or wheezing that doesn't seem to go away can be one of the lesser-known but important signs of a failing heart. Many people assume that a lingering cough must be related to a respiratory infection, allergies, or even smoking, but in reality, it can be a direct consequence of the heart's inability to pump blood efficiently. This happens because lying flat allows more fluid to shift toward the lungs, intensifying the feeling of congestion and making breathing more difficult. Others may experience a wet cough that produces pink or white frothy sputum, which occurs when fluid mixes with a small amount of blood from delicate capillaries that have been damaged by high pressure. This particular symptom often alarms doctors, as it signals that the heart's pumping ability has deteriorated to a point where fluid is actively flooding the lungs. In these cases, the cough is not just an inconvenience, it is the body's desperate attempt to clear airways obstructed by fluid. In addition to coughing, many individuals with heart failure experience wheezing, a high-pitched whistling sound when breathing. This occurs because the swollen, fluid-filled airways become narrow and less flexible. It can easily be mistaken for asthma or bronchitis, which is why heart-related causes of wheezing sometimes go undiagnosed at first. The distinction lies in the underlying mechanism. In asthma, the airways are inflamed and constricted due to immune reactions, while in heart failure, they are compressed and irritated by internal fluid pressure. When doctors hear both wheezing and crackling sounds through a stethoscope, especially in a patient who also shows signs of swelling or shortness of breath, they immediately suspect that the heart may be at the root of the problem. This persistent cough and wheezing can significantly interfere with daily life. People may find themselves waking up frequently at night, coughing uncontrollably, or needing to sleep propped up on pillows to ease their breathing. Simple tasks, such as talking, eating, or walking short distances, can trigger bouts of coughing that leave them exhausted. Over time, the constant struggle for air can lead to fatigue, anxiety, and sleep deprivation. The symptom may fluctuate from day to day depending on fluid levels, but it rarely disappears completely without addressing the underlying cardiac issue. Doctors monitor this sign closely because it reflects the ongoing struggle between the heart and lungs to maintain proper oxygen exchange. The presence of a persistent cough or wheezing is more than just a respiratory issue. It is a clear physiological signal that the heart's ability to circulate blood efficiently is being compromised, causing fluid to accumulate where it should not be. Confusion or trouble concentrating is one of the more subtle and easily misunderstood signs that the heart may be failing. Unlike shortness of breath or swelling, this symptom affects the mind rather than the body, which makes it harder to recognize as a heart-related issue. The brain is an organ that relies heavily on a constant, rich supply of oxygen and nutrients delivered through the bloodstream. When the heart's pumping efficiency declines, the amount of oxygenated blood reaching the brain decreases. Even slight reductions in blood flow can impair mental function, leading to symptoms such as confusion, forgetfulness, and difficulty focusing on simple tasks. Doctors often notice that patients with advancing heart failure become mentally slower, more distracted, or have trouble following conversations. This happens because the brain is sensitive to even small changes in oxygen levels, and when deprived, its cognitive functions begin to decline.